A very good morning to all the attendees who have joined us for this session this morning, where we'll be delving into discussing brain stroke, time to take action. Now, as much as we know, stroke, of course, is a medical emergency where every second counts. Yet, awareness and timely interventions remain major challenges till date. I'm sure we all are ready to learn and understand more about this discussion today, where we have the privilege of speaking with Dr. P. Vijaya, who is the president of Indian Stroke Association, fellow World Stroke Organization, director, Ankineedu Advanced Stroke Center, Lalitha Group of Hospitals, Andhra Pradesh. She'll be shedding light on stroke prevention, early detection, and the steps we must take to improve and save lives. So let's get started on this critical conversation. But before we begin with any discussions, Dr. Vijaya, let me take this moment to congratulate you on your recent appointment as the president of Indian Stroke Association. Many congratulations, ma'am.
Thank you, Khushbu.
Um, right. So I think, ma'am, before we discuss into interventions, challenges, and more about understanding the public aspects of stroke, why don't we just start for the common public out there, just for us to understand and our viewers to understand as to what exactly is brain stroke. If you could just please let us know what a common man should know about this disease and how we can take action around it. Over to you,
Yes,
ma'am.
that's a very good question, Khushbu. Brain stroke is a very unique disease, unlike any other disease, because it is not a thing which people think it will happen to them. It comes like a tsunami, suddenly, unexpectedly. People don't think that will get it, and they don't recognize it in time. There are people think that there is no treatment for brain stroke. Whenever they think stroke, it is only heart attack for them. So we have to be very clear that the stroke is a brain attack and it can happen to anyone at any age, at any time. And if you don't recognize in time, brain will be damaged permanently and the person will be disabled for life, which is the unique thing for brain stroke. But if you act in time, there are very good evidence based treatments and you can save the person from getting bedridden and the life. This is a very important aspect of brain stroke. You have to be prepared, you have to be stroke ready in a community as an individual person.
Mhm. Ma'am, you said
Yes.
that this condition can happen with anybody of any age at any point of time, and there are no certain, factors that we could undermine to understand if there's a risk factor to this disease. But for us to understand what probably can be, and now considering the high disease burden and mortality rate that we have already because of this disease, if you could just help us understand what are the common risk factors and how can people reduce that risk so as to make sure that they are at least in the low risk factor range of getting stroke.
Okay. There are actually the risk factors for stroke are common to other diseases as well. The most number one cause of is hypertension and diabetes and age. Most of the strokes can happen in old age, but can happen at any age. Heart disease, especially what is called atrial fibrillation, and lifestyle diseases like excessive smoking, alcohol, obesity, lack of physical activity. And recently, we also found that air pollution and obstructive sleep apnea are also a really important causes of brain stroke. Family history is another thing. If you have a family history of stroke, you are more likely to get a brain stroke. These are some of the important risk factors. Most of
Sure,
them are
ma'am.
modifiable. That is the main concept that we should understand. Many of these risk factors can be modified with awareness and with proper precautions.
Correct. Ma'am, so much so that we talk about, just getting out there, making people aware about the risk factors, helping them understand the timely interventions. Despite all the advances that we have currently in stroke care and management and interventions, the situation in our country is still that the awareness of this disease is very low. And I'm
Yes.
sure when you deal with a lot of patients around brain stroke and care, and also the caregivers, I'm sure that you also might come across a lot of misconceptions that people currently have around stroke care and management. So, if you could just help us understand a few misconceptions that you often encounter and how probably we can address that.
Yes, yes. The most important misconception, as I was mentioning, is they think stroke is only heart attack. But they should understand it happens in the brain. The second concept is they think that there is no treatment for brain stroke. It is true till 1996, but from 1996 we have many evidence-based effective treatments like intravenous thrombolysis, mechanical thrombectomy, stroke unit care, rehabilitation, technology-driven advances, all the things. But everything is time sensitive. They don't think it is, they take their own time. They'll call their relatives, they call their people, and then slowly they come. They don't understand the importance of time. Every minute matters, as you have mentioned. The third thing is they still believe in local medicine. In our country many people go for native medicines despite having a good medicine in the allopathic medicine, good treatments. This is a very important gap in our country, especially the rural areas. We should take the message of that stroke is a treatable condition. It has good treatments and it can become normal. This is a very important message that we should take to the public.
Sure, ma'am. While we address about misconceptions and also some of the common measures that you also just recommended that these things should be taken care and in account when you at least are a caregiver to a stroke patient or dealing with something that is as deadly as this. But I'm sure there are a lot of national level measures that are already being taken just as to ensure the landscape the care landscape of stroke prevention and management improves in India. So, if you could just help us a few national measures that you have in your account that are already being taken in the country.
Yes, yes. India has been proactive. A government of India has rolled out the NCD program way back in 2010 itself. It has been working stroke and other non-communicable diseases. We have made a great impact with this alone. And in addition, we have this Aishman Bharat, which has a stroke care under its coverage. The third thing is about the giving antihypertensive drugs and anti-diabetic drugs free to everybody with 104 ambulances and in the PHCs. These three initiatives have really had a great impact on controlling the burden of stroke to some extent. But still, we have a huge burden to take care of. And coming to ISA, Indian Stroke Association has many more activities to have an impact on the stroke care. First and foremost, we have been working to standardize the care. We are the third country in the world to make stroke accreditation happen in our country. It started in 2022. From 2023, we have a lot of these accredited hospitals to make a standardized stroke care. The second thing is we have a lot of public education activities, especially in the October stroke month. The World Stroke Day is 29th of October, and we have a month-long activities in the month of October to have uh, patient awareness. We use the social media and the NGOs to have an impactful effect throughout the year. In addition, we do have a lot of training programs which we'll be talking in the course of your interview to increase the capacity building. So multi-pronged approach from the ISA to decrease the burden of stroke.
I'm sure, ma'am. We all know ISA's contribution in managing stroke care and also capacity building that you just mentioned. And you just mentioned we would delve into deeper discussions on what ISA is currently doing or planning to do in the foremost years, and also your vision, ma'am. But we also were talking about some national measures that are already being taken, and probably some measures that ISA suggests can be taken in terms of infrastructure building and just to make sure that the primary and the secondary care care infrastructure at least accommodate stroke care and prevention. So in your view, ma'am, how can primary healthcare centers and smaller hospitals for that matter can be better equipped to handle such situations, just as you said that there is a golden hour that's already there with stroke care and prevention and every second counts. So especially in rural areas, what is your take in managing and equipping the smaller hospitals in better place?
So the most important thing is that be stroke aware and stroke ready. The individual should be stroke ready, the community should be stroke ready, and the professionals, which includes not only the physicians, neurologists, as well as the community workers and the nurses. multi-purpose workers which are the first contact in this in the community. All the chain of these people, individuals, right from the public awareness should be strengthened. Unless they know it is an emergency, they cannot come in time. And once they come to a primary health center, they should recognize it as a stroke. For this, we have very simple training stroke scales with the, as you know, the acronym FAST, FAST, FAST. With a simple acronym, F is face, A is arm weakness, F is a deviation of the mouth, S is speech, T is time to immediately go to a stroke ready hospital. These things we can teach the community workers who are there as the first contact. Once they recognize it is stroke, they can do a preliminary workup, just do the BP and sugar, and then refer them to the nearest stroke ready hospital. If you have a geotagged centers information at every PHC level, this can happen. So basically, we have to build a network of stroke care chain, starting from the primary centers to the district level hospitals and to the tertiary care academic centers. This is a big, huge work, and we are, many of us, all of us have to be committed to this stroke care. Very important is it's a system where we have to build slowly.
Right, ma'am. And as we mentioned in the start, considering the high burden of the disease and the lack of awareness and timely interventions, it's very important for us to emphasize on building more and more stroke-ready hospitals, and just to make sure that the smaller PHC workers are well equipped with stroke care management in the golden hour. Rightly said, ma'am. We also in the start discussed about the risk factors, where you said that hypertension, diabetes are few of the risk factors that are probably lifestyle risk factors, but are the major causes of which could lead to stroke lately. But when we discuss about policy interventions and national measures, do you think there should be some policies or programs that manages diseases such as lifestyle diseases such as diabetes, hypertension, and what programs do you advocate to combat these risk factors?
No, as I was mentioned, there already a program in place, the NCD, which takes care of cardiovascular diseases, stroke, and cancer. All of them have common risk factors. So that is the screening of hypertension in the public. This is a very good initiative that we are taking up by the ISA this year. Before everything, I would like to again emphasize the stroke burden in our country. As you mentioned, it's a huge stroke burden, but it is, you have to imagine 18 lakhs people have brain stroke every year. Every minute, three people get brain stroke, and 50% of them are left with permanent disability. And the mortality rate is anywhere from 10 to 30%, especially in the rural areas. This is the huge stroke burden. And what to decrease the stroke burden is you can use just simple measures. As you said, risk factor awareness that anybody can have a hypertension or diabetes. And most of them are silent. Unless you check, you will not know that you will have hypertension. These simple measures will go a long way in controlling. And
Absolutely, ma'am.
yes.
Yes, please.
Uh, so the stroke burden is huge, and it is very important to have a emphasis on every level, from the primary prevention to acute care to secondary prevention. What happens is once a patient gets stroke, they will have another stroke. So we should be ready to counsel them and to take care of them post stroke, and rehabilitation and reintegration into the community. It is a chain of care, what we call continuum or stroke care continuum. It starts from the house to again reintegration into the community. At every level, we have to take care at preventive level and treatment level and post stroke level.
Correct. So yeah, I mean, as you said, comprehensive approach is the key to manage stroke well, and awareness and timely interventions at every level is important to just make sure that the patient at least responds to the medications and interventions correctly. Ma'am, during the course of our discussion, you did mention briefly about some initiatives that ISA has already taken or is planning to take in. But if you could just help us in a gist of some of the key initiatives that
Right.
ISA has already undertaken to improve stroke care in India.
So, as the president of the Indian Stroke Association, this year I am going to have the vision along with my predecessors. We all work for to decrease the stroke burden in India. We have been doing this for the last 25 years. And the theme for this year is brain stroke, time to take action, which means we have to be at individual level, at community level, at organizational level, as well as the policy makers. Everyone should take an action on this and make stroke a priority at every level so that we can all work together to decrease the burden of stroke. And how we are going to do this? First is
Hmm.
advocacy. Advocacy to have a national stroke action plan, which is will be more dedicated stroke plan. So far, we are having it along with other non-communicable diseases. We are all working to have a dedicated stroke action plan for India, which will have more emphasis and focused emphasis on brain stroke alone. The second thing is to make the empowering the public. The most important gap is that we have to empower the public using all the media, not just the professional organizations. We are planning to work with the NGO organizations this year, and our Rotary International as well as the Red Cross Society of India have agreed to work with the Indian Stroke Association for a year-long activities to take the message to the public with a check BP stop stroke program, which is very very useful. We are going to start this program in our place this month, and from next month we are scaling it up all over the country. This is the second thing. Third thing is to develop the infrastructure of the stroke infrastructure. My vision is to have a stroke unit at every district hospital level. Most of our district hospitals are having CT scan, which is a must for to take care of the stroke patient. So if we just build a small stroke unit with a trained personnel, the sisters and the community workers and the physicians at that level, we can take care of the most of the stroke patients immediately nearer to their home. So we have to build the stroke infrastructure, improve the awareness, build the infrastructure, and last but not the least, to use the technology. The latest technology is very innovative. We have many low cost innovative solutions like telestroke, telerehabilitation to use it to get our management to the and every corner of our huge country, especially the rural areas and the remote areas. We also have stroke ambulances, and all these things are new things that are happening in our country. And ISA is working with at every level with the government organizations, with the NGOs, and with the public directly to strengthen the stroke care.
Correct, ma'am. Once again, we wish all the very best to ISA for all the plans that, ma'am, you've chalked out for the next coming years. Specifically, your vision to make stroke care more, and also to make sure that the people who are at the caregiving end are also more equipped with the correct interventions and
True,
timely interventions,
true, true,
and at least are able to manage the golden hour period of stroke correctly.
true.
Ma'am, in the start, you also mentioned about ISA's contribution in standardizing stroke care and
Yes,
accreditation. You also mentioned, I think India is probably the third
third
country, if
country
I'm
in the
not
world. Yes,
mistaken.
right, right. So
So, if you
this
could
is
just
called.
elaborate more on that, ma'am.
Yes, yes. This is called a disease specific accreditation, which is a unique thing. Like a hospital is fully equipped to take care of stroke patient or not, there should be some standards, minimum standards. The ISA has developed this concept in 2022, and where we have laid down the standards for requirements for a primary stroke center and an advanced stroke center, which will have all the facilities to take care of the serious patients also, all types of strokes. These have been formulated, and then we have been working with the QAI, the Accreditation Institute of India, Quality Accreditation Institute of India, which has taken up this initiative in a big way. And we already have more than 28 centers accredited in India, in various parts of India. This is a very, very unique thing, and this is only third country in the world to get this one. So standardized care means that all the patients will be getting the evidence-based, guideline-based treatment. That's very important because stroke is a heterogeneous disease, and stroke treatment is also heterogeneous in our country. We need to standardize the care to the with the evidence-based scientific backup.
Absolutely. Evidence-based practices is the way to go through. Ma'am, we also, I mean, in the start, you also mentioned about a stroke patient having a probability of having the second attack of stroke as well. There comes into picture the need of stroke rehabilitation and post-stroke patient care, which you
True,
briefly
true.
elaborated in the start. But if you could just help us understand ISA's steps or Maybe the future steps that ISA is envisioning to take care and enhance stroke rehabilitation and post stroke patient care in India.
Yes, that's very neglected a segment of stroke care, Kushbu, because once a patient is admitted in the hospital and discharged, everyone forgets about him, including the family members, unfortunately, and they think this is it, that we cannot do more than this, and the patient also resolves that he goes into a state where I am doomed to be like this, which is not at all true. With the latest technologies and advances, there is a high chance, even if unfortunately if you get a brain stroke, there is a high chance that you can recover to a greatest extent and come back to your normal life as much as possible. This is if you give the post stroke discharge support. That's very important. Once a patient is discharged, we have to follow them up either telephonically or physically. You should follow them up at least for 3 months so that they will understand what steps they have to take for a secondary prevention. There are two types of prevention, as you have mentioned. The primary prevention is where not to get the first stroke itself. This is done by taking care of the risk factors. You check everybody after the age of 18 years. It is recommended now to check their BP, and after 40 years, at least once or twice a year, they should check their BP and sugar. They should take care of their weight. They should take care of their diet, healthy diet. All these things will help in primary prevention, not to get a stroke at all. But once you get a stroke, you have to take, that is something called secondary prevention. That means your chance of getting a second stroke is 10 times more. What is the way to prevent this? You have to take regularly medicines lifelong. The blood thinners, the statins, the hypertension, diabetes medicines, in addition to your lifestyle changes. For this, you have to counsel the patients as well as the caregivers to have a long term plan and follow up. The second most important thing to restore their function is to use rehabilitation, which unfortunately is very not at all developed in our country. Most of the rehabilitation centers are there only in the urban areas and high cost. So we have to make a way to have a low cost community rehabilitation centers sponsored by the government or the NGOs, where the patients can have the rehabilitation nearer to their home and get it free of cost. The other way is, as I was mentioning, there is technology to have a tele-rehabilitation. We can telecast everything to the patient's home. They can sit at their home, look at their TVs or computers, and the instructor will be giving what to do, how to do. They will be doing themselves. This is another very low-cost, technology-driven solution. So we have so many ideas starting from our previous immediate past president, Dr. Nirmal Surya, has been emphasizing this rehabilitation. We are going to take forward that part also, in addition to the acute care and pre-hospital care.
Correct, ma'am. Thank you so much for sharing your views around accreditation and also post care treatment. Ma'am, while you were sharing your inputs about how we can better manage the primary interventions, the tele broadcasting of stroke care and everything. There are very segmented fragments that we talk about. So there's the government where we want their enhancements in making PHCs more equipped with stroke care and everything. There are some healthcare professionals whom we also want that they are also equipped with correct and up to date technology and up to date treatment guidelines and standardizing of stroke care. And there's public where we want them to be equipped with at least the right set of key interventions that they can do just
Right,
to make sure
right,
that the stroke patient is reaching to the hospital. But
right.
all of it requires collaboration. So, ma'am, being the president of ISA, how do you think that we can bring these different stakeholders together for better stroke care?
That's where the ISA comes in to link these things. As I was mentioning, you have rightly said, there is this just like stroke care continuum we have from pre-hospital to rehabilitation. The stroke care strengthening needs right from the government organizations and the ICMR and the NGOs and the professional organizations, both neurologists, physicians, emergency physicians, to the community workers, sisters, and paramedical staff, to the public. So we have the programs spanning and trying to bridge this gap very much. This is how we are planning to do our stroke care strengthening with advocacy. We are working with the government and other organizations to make a stroke as a priority at every level and especially the national level. Second thing is capacity building and training. We have a lot of developing lot of modules to train the physicians, emergency physicians, and the paramedical staff. Third thing is to work with NGOs and to make the public very much aware and to use the social media, print media, and the audiovisual TV media to spread the message. In fact, I would request on this platform all the support of all the media, which is a very powerful tool to take it to the public to help us in this great war against stroke. So advocacy, partnership, and using
Sure.
technology, these are the things that we are leveraging our plans.
Sure, ma'am. And I'm very hopeful that via this platform and also many other platforms that we're planning to build, we are able to reach to the right set of people to just make sure that the interventions are right in place. Ma'am, now since we're proceeding towards the end of the segment of this discussion, before we part ways, ma'am, we know that you're a strong advocate of stroke care standardization, as we've enough emphasized during the discussions today. But just in your innovation, what reforms would you like to see as an ISA president or just a stroke care, or as a healthcare professional who's managing stroke patients almost on a daily basis? What reforms would you like to see in India's healthcare system regarding stroke management? And also, if you could help us understand, in your view, what is the biggest challenge that you see in stroke management in India today, and how possibly we can overcome it?
Okay, okay. So so much to answer. Yes, thanks, Kushbu. So I would like to make stroke a priority for the individual, for the community, for the government and policymakers and our professionals, of course. Stroke is always given a not a important thing, but they should understand that stroke should be a priority for everything, for all of them, to for prevention, to treatment, to rehabilitation. Number one. The greatest challenge is again the awareness. Not only the awareness is poor among public. For example, only less than 40% of the people could name a stroke symptom. 60% are not aware in a survey. This is a very poor, this is a very big gap. And coming to the professionals, even the professionals, non-neurologists think that stroke is not an emergency. They are also not aware of the importance of time and the treatments available nearer to them. This is another gap. Third gap is, of course, to bring down the equity of care. The affordability is an issue. Once we have a, for example, let us talk briefly about the treatments available, Kushbu. This is very important because, as I was mentioning, stroke is a treatable condition. So if you come in the golden period of 4.5 hours to a stroke ready hospital, they will do a CT scan and then we can give the clot busting drug that is called IV thrombolysis, which can restore function in majority of the people. But many times only 10% of the people come in time and only 1% of them get thrombolized. This is a very sad situation and the big gap in our country. This is not very costly, and most of the some of the states have made them free available. The IV thrombolysis is given free in some of the states like Tamil Nadu and Kerala as well as in Andhra Pradesh in the government setups. And with Ayushman Bharat, I think we can leverage this one to most of the needy patients. But they should come in time. Unless they come in time, you cannot give the treatment. And there are also latest treatments called mechanical thrombectomy, which can be given up to 24 hours now to save the patients. Once upon a time, which we used to lose all of them with brain stroke. So all the acute treatments are available. Stroke is a very much treatable condition, but it is a very time sensitive disease. The gap is to awareness and to coming in time and coming to the right hospital. Another gap in our country is they don't come to a stroke ready hospital because they don't have the concept of what is a stroke ready hospital. Brain stroke requires a CT scan in the emergency and a physician or a neurologist within 10 minutes of their arrival to assess them. If it is, unless we develop this sort of a infrastructure, patient will not be benefited. We should have, we are planning to work with other organizations to have a geotagging. geotagging for all the stroke ready hospitals and the primary stroke centers and the advanced stroke centers. If we have this information for public, they will reach the proper hospital in time. So many people, even though they can afford, because of this lack of awareness, they go to normal hospital, and then by the time they come to the stroke ready hospital, the time is already gone. This is a huge
Okay.
gap. This thing we have to bridge with the proper public awareness and professional awareness and a network. We have developed a network right from the uh, grassroots level to the top, a network of hospitals.
Right. And ma'am, lastly, what message would you like to share with the public who's possibly viewing this session with an envision of just learning more about stroke care management from you? What message that you would like to
Yes,
share with the
yes.
public regarding stroke care
Let me,
management
that's very important. Thank you for giving me the last word.
regarding stroke
We are
awareness and
all,
stroke?
yeah, stroke is a brain attack. It is a treatable condition, preventable condition, and you
Yes,
can
ma'am.
become normal. You have to know your own risk. Check your risk with very stroke riskometer and other apps are there online, which will ISA also will provide to check your risk and then correct them. 80% of the strokes are preventable. That's a very, very important concept that you should understand. If you adapt correct lifestyle and take care of your risk factors, like taking proper and lifelong treatment for hypertension and diabetes, you can prevent a stroke. Even if you get a stroke, there are very good evidence-based treatments if you go to a proper hospital in time, golden period of 4.5 hours. Then that is second part. Third thing is, even if you get a stroke, you can recover with the latest technologies of rehabilitation. You need not be depressed or worried. With proper care by the professionals and your caregivers, you can become a normal person. So don't worry about stroke, but be careful about stroke. Be stroke aware and be stroke ready. I send this message to at every level. Be stroke aware and be stroke ready at individual level, professional level, and community level.
Well, thank you so much, ma'am. As we conclude this discussion today, it was an insightful experience for me as well to understand as to the gaps that are there currently and what ISA envisions in the future to just build a very resilient roadmap of stroke care management. Thank you once again, and we wish ISA and you, as the president, all the very best for the future plans and the endeavors for stroke care management.
Thank
Thank you
you.
so
Thank
much.
you.
And to all the attendees who joined us today, we're delightful for you to be joining us today. Thank you so much.
Thank you. Thank you, Khushbu. That was a useful, very useful program. Thank you. All the best.
Thank you so much. Pleasure all ours, ma'am. Thank you.